Life for Americans has changed drastically in the last few weeks, and for many it may seem like there's just no end in sight. Evening Edition's Eleanor Buckley spoke to a Danville doctor who says because of the strict guidelines and our early actions on social distancing, he believes the number of cases will be much lower here in Kentucky.
There's still a long way to go in this disease process, and I think we're only at the beginning of it. So if people think that social distancing is going to disappear, this is going to remain for a long time.
Dr. Palaki Ravi is a family practice physician in Danville. He's been screening coronavirus patients out of Integrity Extended Healthcare for about a month now. And he says so far he's only seen a handful of positive cases. But he believes it is in part due to the governor's early action.
Governor Beshear's direction initially with the essential shutdown of Kentucky and being one of the first states to implement this shutdown has allowed our case detection rate to be in the single digits, and we want to keep it there.
And he says Kentuckians should know, though, that the number of cases may be somewhat deceiving in the future because as testing becomes more readily accessible and more accurate, the total number of cases could go up.
It is going to increase our caseload, and yes, we're going to have more positive cases because the tests themselves will be more sensitive and specific.
But he says there's still a long ways to go before we get there. And in the meantime, social distancing may be a norm of society for a while. But he believes we are lucky in Kentucky, and he doesn't think we will see that kind of surge and overload of cases here that we've seen in New York and LA.
There's still a lot more work to be done. We have to continue doing this to keep those numbers in the single-digit percent to where our hospital systems can handle the capacity. And I think we're going to be able to handle the capacity as a state. So I think social distancing is very important. We need to continue to practice that.
Eleanor Buckley, LEX 18 News.